Okay. So we recognize and acknowledge the indigenous land of which we live, work, learn, play, and grow. This land of the pardon me if I butcher the names, the Maloya, Paiute, Klamath, Modoc, Yahuskin Band of Snake Indians, Confederated Tribes of Middle Oregon, and Confederated Tribes of Warm Springs. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children. So it looks like we could use a little grammatical help, work on that. But it's great. That was fantastic. Hopefully that's for the tribal members with us. We'd love for you to provide input if you haven't already. I'm guessing you have, but if you haven't, love to hear from you on that. So the meeting practices, there has been input from, I think, both members and non-members on our meeting practices, and ideas have been shared for ways to make our meetings more welcoming and more comfortable for, you know, a broad spectrum of people with different experiences and so forth. So I believe this is a summary of a lot of those ideas and things that seem to make sense. And so I don't know that we're going to have time today to receive input from those who are present today, but Michaela, would you like to read them?
Yeah, for sure. And these are things that, like Brad said, we're trying out. So we would love your feedback and as we implement some of these things, but we're really wanting to make these changes to make the CAC more warm and welcoming and make sure that everyone feels comfortable and is able to participate at the meetings. So some of the changes that we're wanting to make is to make the meetings less kind of institutional feeling and less formal, to kind of create that welcoming atmosphere. And some examples that we're wanting to try to implement are using more plain language, you know, less acronyms, things like that, have more conversations and less PowerPoints, and kind of simplify the voting process. You know, an example of that would, instead of, you know, having like a formal motion, you know, asking for votes, to make that process a little easier. We are wanting to, as you may notice on the screen, rename CAC and supporting staff and guests and listing them as such, just to help identify who's who in this virtual space. And it's, you know, maybe easier for new guests or CAC members. We aren't, you know, sitting around a table, so it's kind of hard to see and to tell who's the CAC members, who are the guests at this meeting. We're asking, when we do introductions, we're asking the Health Council, Pacific Source, and the Oregon Health Authority to share, you know, why are we here and what's our role in supporting the CAC while we're here, so that piece is clearer. We're wanting to invite all CAC members in attendance to share their input during discussion and before decisions are made. And we want to prioritize consumer representatives to make sure all voices are heard. And this may look like, you know, it may look like we're calling people out, but really we're just wanting to make sure we hold space for everyone to be able to provide that input. And that input may be, you know, provided in the chat, or if you don't have any input, that is perfectly fine. We just want to hold that space. And then the last one is we're wanting to build relationships between the CAC members. And it's incredibly hard to build relationships in a virtual setting in Zoom. And so we're wanting to set aside just a few minutes for CAC members to go into little breakout rooms in Zoom. And we have an icebreaker question for you to answer, but if there's, something else you'd want to talk about with your fellow CAC members, that's perfectly fine.
To clarify, Michaela, is the 12:20 to 12:30, the small group breakouts, is that to discuss this and get feedback, or is there no purpose to that? I apologize, I knew this before and don't now, so.
Yeah, this is a time for our CAC members to connect. This is actually going into those small breakout rooms.
So not necessarily about these ideas, but that could be something people talk about.
Mm-hmm.
Okay. Yeah, it's one of the structural changes is to just carve out those 10 minutes for us to connect in smaller groups. I'm excited about that. So I guess as far as the meeting practices, if you do have input on that, feel free to reach out to me or Michaela or any of I think maybe Gwen, Kelly, all those involved in managing the CAC, and or talk about them in your small group breakout session in a few minutes. All right, so introductions, and are we doing anything differently with introductions? I think we talked about limiting them to the, help me out.
Yeah. Thanks, Kelly. Yeah, so for introductions, CAC members introduce themselves, and then anyone here from the Health Council, Pacific Source, OHA, or anyone else, if they'd like, speak how what's their role here in supporting the CAC. And then guests, you can share your name, organization, or community member to introduce yourself.
Okay, so beginning with CAC members, I guess I'll start, and then if somebody could help me, because I have trouble. Actually, we now have everybody with CAC before their name. That actually helps quite a bit. On the screen, your name says CAC now. So I'll go ahead and start. Brad Porterfield, community representative, the CAC chair, member of the Health Council Board, liaison for the CAC, and also executive director of the Latino Community Association. I live in Redmond. Let's go to Tom.
Hi, I'm Tom Kuhn. I'm a CAC member and the Deschutes County Public Health member representative, and I work for Deschutes County Public Health as the community health member.
Thanks, Tom. Regina?
CAC member, and I work at the Crook County Health Department and represent for our community here in Crook County.
Thanks, Regina. Elizabeth?
Thank you.
Hi, I'm a CAC, I can't even talk, a member, and I'm glad to be here. Thank you.
Thanks, Elizabeth. Mandy?
Hi, everyone. I'm Mandy Seeley. I'm a consumer rep on the CAC, and I'm in Sisters.
Thanks, Mandy. Is that everybody, or is there somebody on the phone who's a CAC member? Do we know who's on the phone? Who's on the phone?
I see somebody on the phone ending at 5002.
Yeah, that's Buffy.
Oh, hi, Buffy.
Yeah, I don't have a way to tell. I guess you guys can maybe just remember my phone number because I'll always be calling in. So you can put my name, but I won't be able to put my name in there.
Okay. All right, and we will come back to you for your introduction. Would somebody on the staff mind going through staff introductions? Helping with that?
I'll call out everyone. Let's start with Donna and then Michaela.
Good afternoon, everybody. I'm Donna Mills. I serve as the Executive Director for Central Oregon Health Council, and my pronouns are she, her, and hers.
Hi, everyone. This is Michaela Arsenault. I'm project manager at the Central Oregon Health Council. My pronouns are she, her, and hers, and my role is CAC coordinator along with Gwen. And what that really means is, we're behind the scenes support staff, making sure that the meetings run well, that we have material, that we're pushing projects along, and so forth.
Next, we'll do Gwen and then Camille.
I am Gwen Jones. I use pronouns she, her, hers. I'm also project manager and co-CAC coordinator with Michaela, and she did a great job explaining our role. Thank you, Michaela.
Hi, I'm Camille Smith. I'm the administrative assistant at Central Oregon Health Council, and I just love the work you're all doing here. So I support that.
Great. Next, Renee.
Hi everyone, Renee Worth. I am also a project manager with Central Oregon Health Council. My pronouns are she, her, and hers. I work closely with Gwen and Michaela, especially with the work groups of the Regional Health Improvement Plan. I know some of you are on some of our work groups, and I'm happy to support you in any way if you want to get connected with any of the work groups or just grab a cup of coffee or go for a walk. I'd like to get to know each of you better. So thank you all for being here.
And then lastly, I'm the last one for our support staff here at the Health Council. I'm Kelly Adams. I provide admin services, and I'm helping out Michaela and Gwen with the CAC. I'm taking notes, and I am happy to answer any questions, especially technical questions that you may have during this meeting. And now we can go to our guests for today. First, let's go to Carolyn.
Thanks, Kelly. I'm a guest. My name is Carolyn Black. I am with the Oregon Health Insurance Marketplace. And what I do is provide outreach and education to those that are not eligible for OHB. And I'm just here today to learn more about what you all do.
Great. Next, let's do Federico.
Hi, my name is Federico Corso Fernandez. I'm also with the Oregon Health Insurance Marketplace. And I am with Caroline, and I'm a training process. I start the 4th of this month.
Thank you. Next, we'll go to Kristen and then Miguel.
Hello, my name is Kristen Tobias, and I am the Community Health Coordinator for Pacific Source. And part of my job is to work as a liaison between the CAC and Pacific Source. So concerns that are brought up or any issues that CAC members bring to this meeting, I take that feedback back to Pacific Source to hopefully find a solution.
Thank you, everybody, for having us back. My name is Miguel Angel Rada, pronouns he and him, and I serve for Pacific Source as the health equity strategist. So my role there is try to find ways to improve our services and products with an equity point, from an equity point of view. So applying an equity lens wherever it's possible, and advance the diversity, equity, and inclusion agenda at a regional level. That's my role. Thank you.
Thank you. Next, Stacy and then Tanya.
Are you talking about me, Stacy?
Yes, Stacy.
Okay, I wasn't sure if there was another Stacy. Hi, I'm Stacy Shaw. I learned about this community advisory meeting through a public health course in my college, and I decided to join today to see what basically takes place. So I'm here as just a public community person. Yeah, thanks.
Thanks, Stacy.
Hi, everyone. My name is Tanya Curiel. I am with the Oregon Health Authority and the Community Partner Outreach Program. I'm the Regional Outreach Coordinator serving Central Oregon. And the work that I do is connecting the state with community organizations and providing training to assisters who help with Oregon Health Plan and other public medical assistance programs. So my role here is to listen, learn, and help whenever I can. Thanks, everyone.
Thank you. We have Trisha and then Buffy, please.
Hello, everyone. I'm the director for Central Oregon for the CCO for Pacific Source. So similar to Kristen, I'm here to gain understanding, learn and understand processes, and to offer support where asked, when asked. So, and I use she, her, and her pronouns. Buffy.
Hi, thanks. My name is Buffy Hurtado. I'm an enrolled member of the Confederated Tribes of Warm Springs. I currently hold the position of Tribal Liaison for Pacific Source. I work with all 4 of our regions, as well as the 9 tribes of Oregon, Indian Health Service, and NARA, just to advance and stand up tribal affairs, tribal relationships, and tribal engagement. So that's kind of my priority. Thank you.
Great, thanks, Buffy. I believe I was able to call on everyone. Anybody else out there?
Hi, I'm Rebecca Donnell. I'm the innovator agent with the Oregon Health Authority External Relations Division, and I work with the Pacific Source CCOs and the community advisory councils in their service areas. So thanks for having me today. And my role is, like many of the roles here today, a liaison, but a liaison with the Oregon Health Authority and a partner with the CCOs.
Thanks, Rebecca. Sorry I missed you.
All right, thanks, Kelly. All righty, so next we have public comment. Is there anybody who would like to provide public comments? Anybody at all? Okay, we will go ahead and move on. So one of our changes in meeting practices is instead of referring to the notes from our meetings as minutes, which has always been a weird term. Where'd that come from? Who knows? But we're gonna call them meeting notes. And and also instead of kind of going through the Roberts rules kind of structure process of making a motion and going through all that, we're going to try a different approach, and I'm just going to ask, is there any comments or concerns about the notes from our last meeting? Anything not look correct? Questions? There are quite a few actions. So I actually wanted to ask, in this case, there's at least like 5 things marked as action. Someone to ask is, will those actions be followed up on through our emerging issues? It looks like most of them might be. Or is there going to be some other space created to kind of report on where those actions are at, the status of each of those actions?
Yes, so those actions are all related to the emerging issues, and so those will be addressed when we get to that piece.
Okay, great. All right, so if there's no concern or discussion around the notes, we're going to get back to our 5-finger voting. So there are 5, looks like, for those among us that are CAC members, if you would, I guess you don't all have your cameras on. So we could either do, so the 5-finger voting, by the way, is 5 is absolutely yes, the notes look great, let's move on. 4 is strong support, but will not champion it. So you're going to vote in favor, but you're not excited. 3 is you support it, you're not against it, but you're also not super excited. 2 fingers would be some concerns, but we'll go along. And 1 is you really can't support it at all. Prefer resolve concerns before supporting. Yeah, so there's concerns you have that you'd like to resolve before saying yes, let's move on. And 0, of course, is no support, you have serious concerns. So if the CAC members do we all have our cameras on? We're all able to have our cameras on. Elizabeth does not. You can either hold up your fingers or put it in the chat. Put the number of fingers in the chat between, again, 0 and 5. 5 being you support it, let's move on, and 0 being you cannot support it, we can't move on. And then 0 and 1 essentially are, you can't support it. There's something we need to resolve before we can move on. So 5 from Mandy. We have 4 from Gina. Anybody else? We have at least 2 other members, right? Okay, Elizabeth, 4 fingers. Thank you, Elizabeth. I'm missing, who else? Who else? Who else? Looks like Elaine. And what if we're missing somebody? Tom. Tom, did you already hold up your fingers? Or put it in the
Yeah, I
chat?
did briefly earlier. Sorry.
Okay, sorry.
I'm sorry, Brad. My meeting that was supposed to end at 12 ran way over, so I just got here. What was the question?
Oh, we're now calling our meeting minutes meeting notes. We're making changes to our meeting environment, our meeting culture, and that's one of them. And the other is we're going to get back to our 5-finger voting, which has been something we wanted to do for a long time, and we're getting back to that. So, and we're also not doing the whole. Would somebody like to make a motion in a second? We're kind of getting away from that as being unnecessary, and just asking people if you have concerns or would like to discuss anything before we approve the notes and move on. And so we're doing the 5-finger voting, which 5 being absolutely yes, let's move on, they're great. 0 and 1 being no, you have issues that you'd like to discuss before approving the notes. And you're the last one, okay. All right, thanks, I think you got everybody. All right, so we have approval of our meeting notes from September. Thanks, everybody. And Elaine, would you like to introduce yourself?
Yes, thanks. Elaine Schultz, community CAC member for a long time. And I'm with Mosaic. I'm the Director of Strategy and Development.
All right, thanks. And is there anybody else who joined us after introductions were done? I don't think so, but okay. All right, well, we're a little bit behind schedule, but not too much. We're going to go into our small groups, and this is another change to our meeting structure. We want to spend at least 10 minutes breaking out into smaller groups so that we just kind of say hello to each other and talk about whatever we want to talk about for 10 minutes. So I think, will that happen automatically, or are people going to have to click
Yes,
a button?
I'm going to send everybody to their rooms. Our guests will be in one room, and then our CAC will be split up into 2, just to get to know each other and encourage some conversation.
All right. What do everybody think about that?
Nice to connect with people.
I agree. That's a huge, huge improvement to our meeting culture, I believe. Anybody else want to comment on it real quick? You approve? You want to do it every time, every month, every meeting?
Yeah, I think it's good to know who we're hanging out with once a month.
Fantastic. All right. Let's move on to emerging issues process follow-up with Gwen Jones.
Hey there, that's me. I'm going to share my screen. Try and take your faces off of it so you don't have to look at yourselves. So can you see 2 pages up on your screen right now? Give me a nod. Thanks, Kelly. So the work that y'all are undertaking are around addressing things that you all experience, you consumer members experience in your world with regards to healthcare services. And so you've developed this process as a way to start getting information and deciding whether to take action and what kind of action to take on those. Last month was the first time we introduced this and started down this road. This is kind of a gigantic experiment because nobody's done this before and we haven't done this before, so we're learning together. And so on the right side of your screen are the process details. So this is the steps that we're going through with each of kind of the hot topics or healthcare concerns that you folks have raised. And then on the left side is the tracker, which is just like the issues that have been raised so far and where we are in addressing those and deciding if we have enough information, do we want to take action, what the next steps are, and that kind of thing. So these are tools to help us not drop them or forget them, but to keep working on them and figure out our next steps. In response to conversations last month, you all are receiving some information today in response to your requests for access to periodontal care and then chiropractic services. So the first two items on the tracker. As part of our process today, we're going to review that information. We're going to we're going to start with periodontal care because that's at the top of the list right now. And pending time, we may be able to start into the chiropractor services. We just have a half hour today. So the chiropractor services will be addressed at our next meeting. And so we're going to invite our OHA, or Oregon Health Authority connector, Rebecca, to share what information she has. And then we're going to have a focused conversation, which is just a structured way of processing information together and identifying what you need, if anything, to be able to move forward, to be able to make another specific ask, take an action, or whatever that may be. Any questions about what the next 25 minutes is about? Go ahead and speak up because I can't see everybody's face.
I have something.
Yeah, Mandy.
So it's not a question, but I wasn't here at the last meeting, but I did watch the recording, and I just wanted to second the periodontal care because that is also something that I'm having issues with. So I just wanted to add support for that topic.
Excellent. So we'll learn more. Great. Thank you. I appreciate that. All right, well, let's jump in then. I'm going to stop sharing screen and invite Rebecca to share follow-up information you may have been able to find with OHA.
Yeah, thanks, Gwen. Well, unfortunately, I don't have a lot of detailed information to share. I did do some research and looked at a number of different member materials, looking for information about specifics around the coverage for periodontal disease treatments. And a lot of the information was fairly high level in terms of summary level information and not a lot of granular detail. And so what I've done is I've reached out to the new dental director, Kaz Raffia, who started with OHA, I believe, in August, and sent them an email asking for more specific information about the periodontal disease coverage, with really specific information about what's covered, when, what the exceptions are, etc. But that's the level of information I have today, is just that I'm still in the researching mode, that I haven't been able to get to, I think, the granularity or the specific information that folks are wanting. I think you've all seen the member materials that are explaining that cleanings are covered, but when you're going in and you're needing specific periodontal care, you're encountering barriers. And so what are those limitations and what are the specifics around that, I believe, is the information you're looking for. And I have not been able to get that information at this time, but I believe that Dr. Raffia will be able to provide that to me.
Thanks, Rebecca. Questions for consumer representatives and CAC members. So what questions do you have about what you've heard from Rebecca so far, about like what, this world is a different language. We try to adjust, but don't do a good job often. So I want to make space to make sure we have questions answered around that Rebecca can answer, like if there's words that are hard to follow, something doesn't make sense. This is a great time to ask. Even we needed to define periodontal care last time. So what questions do you have about what Rebecca has shared so far? Just to make sure that it makes sense to you.
I have a question. So I've been talking to someone about the issue that I'm having, and I was told by one provider that there isn't anyone in Central Oregon who provides this service and accepts OHP. And I was told that legally there has to be someone. So I just want to know if that's true, and if we just don't have someone right now, or yeah.
Mandy, have you called your dental care organization about that?
I have. So I was told to do that, and I have Advantage Dental in Sisters, and they're impossible to get a hold of. So I've left them 3 messages in the last 3 weeks, and I can't get a hold of anyone.
I can give you a phone number for Advantage if you'd like, for their main people.
Okay.
I'll put that in the chat.
Okay.
So yeah, if it's a covered benefit, then they do need to be able to provide that. That doesn't mean that they necessarily have to provide it locally, but they need to be contracted with providers to be able to provide that, and then provide transportation to be able to get someone to and from their appointments. So I'd be interested in hearing what folks say about being able to identify someone as a provider that may not be local, but as a provider that you could receive treatment.
I have, yeah, Kristen, go ahead.
I was just going to say, what we've seen happen in the past, this is a different DCO, dental care organization, but what Capital Dental did was paid for a member to see a periodontist in Central Oregon, like on a case-by-case basis. So it was kind of like, okay, we're going to set you up to see somebody locally once and agree to a payment that'll be provided to that periodontal provider. And then if you need to be seen again, then we'll arrange that again. So it's almost like piecing together like that local help versus having somebody in network. But I can check with Heather Simmons, who's our dental manager within Pacific Source, to ask specifically about Advantage. And I mean, it sounds like we don't have anybody in the Central Oregon region in the Advantage network. So I can follow up with Heather on that too.
I spoke with Deanne Lambert at Gentle Dental, and Capital refers to Gentle Dental. They see the patient, they do all the work. If they want to refer to Salem, they can do that. But this Deanne Lambert, she's Director of Operations, and Gentle Dental is your contact. I used to be a voc rehab counselor. I just wanted to find out the answer. So I followed up.
Thank you, Elizabeth and Kristen and Mandy. One of the themes that I'm kind of hearing here, and I know this, it's triggering memories from previous conversations with Teresa Olander, who originally brought this conversation up, is that there seems to be a shortage of periodontists in the region. I think I'm wondering, I'm going to suggest, I don't know how else to ask this. I'm wondering if part of the question is, why is there a shortage, and what's causing this? And if this is the state of affairs, what options are there for making getting care easier instead of having to knock on multiple doors and go up climbing difficult trees to get to the fruit that we're after. So I'm love to have some CAC members respond to that and reflect on that. Tell me if I'm totally off base or if this is kind of what people are wondering.
Yeah, I would say the same thing, Gwen.
Well, I understood from Deanna Lambert, there's an established procedure. It's a 3-step program. Starts with, is it Capital Reef? They get the referral. They send it to Gentle Dental, and then Gentle Dental does your primary work. And if they see a need for periodontal, they send you to Salem. And I think they pay the whole way and everything. I mean, I think the whole system's already set up. It's just the process, you know?
But that's the people that are actually assigned to Capital Dental. So the people that are assigned to Advantage might not get the right information to climb up those steps like you did with Capital. So that's where the navigation is. Like, how do we know, this person's going to benefit through Capital? How does this person going to benefit through Advantage? So that's the hard part of navigating it.
I don't think Advantage is a part of the system. I think Capital sends to Gentle Dental. It's great. It's over there by Cracker Barrel. And I don't think it's negotiable. That's what I got the idea. It's set up a certain way and boom, you're in the system. So I don't know.
Yeah, so lots of questions, and I think it
yeah, and I'm capturing all of these questions, and I'll forward them on to Dr. Raffia as well. It sounds like maybe we benefit from also meeting with the DCOs. So perhaps myself and Kristen could meet with the DCOs prior to the next meeting to understand in depth their processes. So it sounds like the question goes beyond just what's covered under OHP benefits around periodontal disease, but that actually you're experiencing access challenges and it's hard to navigate. Each DCO has different processes and different ways of accessing care, and then there are limitations because there are only a few providers. And so if your DCO is not contracted with those providers, where are they going to send you to be able to get care? And so I think these are all really pertinent questions. I've captured them. Did I miss any?
Can I just add what I think is really maybe more confusing in Central Oregon than in other parts of the state like Portland, is that like we have one CCO. It's Pacific Source for everything medical and mental health. And yet there's 3 dental care organizations for dental. And I know in like Portland, there's many CCOs. So people may be more acculturated to like every CCO has their own system. But like here, we're used to Pacific Source. We just have one CCO, yet when we step into the dental world, there's 3 different ones who do 3 different things. So like when Elizabeth was talking about her gentle dentistry experience, like that's just Capital. And then Advantage has their whole system, and then ODS has their whole system. So for members, for patients, like how confusing. It's so confusing when we have limited resources. It's just not user friendly.
It's not, and I don't know about now. I haven't seen an updated Pacific Source card or anything like that. But before, they didn't even list who your dental provider was. We used to be able to get into MMIS and see who they were assigned to. That's not even no longer available. And so it was really hard to navigate that for any kind of, for clients when they wanted to know where they needed to start at. So I don't know if that process has been any better, but it doesn't really sound like it because nobody knows where to start.
Thanks. I'm going to pause just for a little bit of language transition. Tanya, I want to thank you for kind of clarifying what DCO is. You put that in the chat, that they're dental plans that coordinate care. And then Regina, can you used another acronym, system. I want to say HMIS, but that's not it. Was it TTI?
MMIS. So that's just the database where we could see where the Medicaid is active or not. I guess that would be OHP to see if your OHP is active or not. I guess that would be the easiest way to explain it.
Thank you. Thank you.
Yeah, sorry about that.
No, that's okay. We're all working on cutting out acronyms.
I forgot about that.
That's all good.
The one time I use an acronym. Just kidding.
Yeah, so what happens is when you get enrolled in the Oregon Health Plan, you get assigned a coordinated care organization. The acronym we've been using is the CCO. That's your medical plan. That's your medical insurance, quote unquote. And then they're also responsible for your mental health and your behavioral health. And so that's who you go to for getting access to care there. Then you're assigned to a dental plan, and we're using the acronym DCO, so Dental Care Organization. And but it's basically your dental insurance, quote unquote, as an Oregon Health Plan member. And I think as I don't know if it was Mandy or someone else was saying that in Central Oregon, there's one medical plan and mental health plan. It's through Pacific Source that everyone has access to, but there's multiple dental plans. And so it gets confusing who you're assigned to, which dental plan you're assigned to, and then what are the steps to accessing care through those different dental plans, and which providers do they work with in the community. And so it's more difficult for everyone to understand, exactly what their dental coverage is, but then also how their plan works, right? And so that's what I think Kristen and I are going to hopefully, after meeting with the DCOs, come back with some more information at another meeting to help provide some more clarity around this topic.
Thank you, Rebecca. We're almost at time for this chunk, and so I just want to hear from a consumer member. What's the next action? I'm thinking back to our what is the action that we're taking at this time to move this forward? I've heard it. Rebecca's talked about it. I just want to get confirmation from y'all that we're all on the same page.
It sounds to me like there's several, Rebecca, Kristen, I think as well, Elaine, they all agreed to kind of gather information. Elaine more about Mosaic, I think Kristen and Rebecca about OHA and Pacific Source, or maybe just Pacific Source, I'm not sure. Basically gathering information to help answer the question, but then we're still, the thing sticking with me is, Mandy's still stuck not being able to get a hold of Advantage, and I know Tanya gave her a number. I don't know if she's going to get any better response by calling that number or not, hopefully. But if that's the expectation, what's that based on? Why is the number she's calling not working and this one's
Mandy, if for some reason you're not able to get through to Advantage, please contact Kristen and myself so that we can help support you and you're not out there waiting for information.
Great.
Can you both put your contact information, maybe email and phone numbers, or what you're willing to share out to Mandy in the chat So she has that readily
Or,
available.
or a suggestion, Mandy, I know this is not the solution for everybody, but actually request to be switched to Capital Dental. So we already know the process to Capital Dental. So you might be able to get further with them instead of waiting around with Per Advantage.
Thank you for bringing that up. All right, so big CAC level. Next month, we're looking for Kristen and Rebecca to bring back additional information that they're able to gather. Rebecca, it sounds like you have what you need to those additional questions to take, and Kristen, you have some questions as well. And then we'll check back in and continue this at our next meeting. All right.
Sounds good.
All right. Nice job. I was very, very wonderful listening to the conversation. So thank you, everybody, for contributing.
Thanks, Gwen. How do people feel about us spending time in each of our meetings working through these emerging issues together? I feel like it's a good way to spend our time, to make it feel like this meeting time is useful.
We can do a 5-finger vote on that.
Do a 5-finger vote on that. 5 fingers, it was awesome. This is awesome. We want to continue. 0, hated it. All right. Fantastic. Thanks, Gwen. So the next meeting, we'll maybe tackle the chiropractic and get feedback from everybody on the periodontal. Cool. Alrighty, Board of Directors CAC action. So in September, we had our combined meeting with the Board of Directors of the Health Council and Community Advisory Council members. And that has been an annual meeting as far back as I think forever. Correct me if I'm wrong, but once a year meeting. And at that meeting, the Board of Directors of the Health Council and the Community Advisory Council members came to some agreements about things that we could do differently to strengthen our relationship and make us more effective at carrying out our mission. So Donna, you're going to report on some of that follow-up?
I am. Thank you so much, Brad. And again, my name is Donna Mills, and I serve as the Executive Director for the Health Council. I just kind of wanted to bring to the group some of the ways that your COHC staff is beginning to operationalize some of the things, or I should say all of the things that both the board and the Community Advisory Council heard in the combined meeting. Very exciting. I mean, leveraging right away what you were just doing and the emerging issues is that we would like to, beginning in our November board meeting, ask a representative of the CAC, and it could be Brad, but I think that really our desire is it would also be a member and not necessarily your board member that also serves as your CAC chair, to incorporate the information on your emerging issues to the board so that there's a report out and the board can actually hear some of these opportunities that have been brought forward to really better the care for you and for our patients in Central Oregon. So we're looking forward to that. We also would like to have our patient story, which has been also forever, Brad, that's always been our opening to our board meetings, kind of to center our board members. And we felt that it would be so much more powerful to have actually a member of the community come forward and give a story on a monthly basis. And I'm not sure, Brad, how we want to do that, if we do a round robin type of action with the CAC members or just whoever raises their hand for the next month. So we'd really like to welcome you to our board meetings with the patient story. To Brad's point, where we've always, and I mean always, had a combined meeting in September, we were really looking at the request of participating amongst each other in board meetings and CAC meetings. The piece of this that we have not figured out is when to bring board to CAC and CAC to board, but you know, your staff, this staff around here is pretty remarkable. They'll figure it out. but really making a frequency of every 4 months that the board and CAC will have some sort of interaction with each other, so that we continue to build those relationships that we heard at the combined meeting are so incredibly important. So the first would be in January, followed by May. And then again, guess what? You're at September in your combined meeting. So, you know, we changed it up a little. We didn't want to change it up too much, so that you had, you could always rely on that September combined meeting. The other thing I wanted to bring to your attention that we also heard in the priority by both the board and the CAC was to continue to evaluate where you were in your relationship. And this, we established the baseline in this particular year, meaning that we captured your thoughts about how much you actually wanted to have relationship versus with how much relationship you actually felt you had. And we will be taking that survey yet again next year to see if we're making progress. So I just want all of you to know that my door, my phone, my Zoom is always open to you. And I know Brad and I know the rest of the staff feel the same way. If you wanted to speak to us more frequently than just on our regular meeting, the meeting calls. So I think that really are going to try to create some more space where, if I might use the term hanging out together, instead of having so much formality around the meetings, and hopefully create a very warm, inviting, and comfortable environment. So does that raise any questions for anyone? Does it sound like a great idea? And I will take the 5 fingers if that sounds good to everybody. Yay for Brad. I just want to thank you.
CAC members,
Go, Brad.
Do your 5 fingers for how you feel about these changes.
Yay, yay, I'm seeing some 5 fingers up there. And not talk to the hand, for those that remember that. Talk to the hand, no. Thanks, Brad. I appreciate the opportunity.
Yeah, no, it looks like we got full support. So it's exciting. These are good changes. And I would just add to that, not only that it be a welcoming and comfortable and, you know, warm and fuzzy time together, but a productive, you know, action-oriented time together as well. So that's all good. Well, hey, we got a little extra time to give to our guest, Miguel Herrada. We're usually taking time from you, Miguel. Today we're going to give you some time. Gracias por estar con nosotros. Thanks for being with us.
Oh, thank you so much. I feel great then. So thank you. Okay, so thank you. Next slide. My screen. Okay. Yeah, next slide, please. Hello. Can you hear me? Yeah.
Sorry, my computer is just a little bit slow.
Thank you, Michaela. So no, the one before, just to give you an idea of what we are. Yes. So thank you, CAC members, for having us here again. We are gonna, our plan today is to give you an update about what happened with the health equity plan. Just for context, it's the first time with Medicaid CCO 2.0 that we ever have the opportunity to submit a health equity plan. This is a 5-year plan, and this is fantastic for us because it really, in the past, it was difficult to advance without having health equity center as part of the contract. So for us, it's really a blessing. It's a great opportunity that has allowed us to get more people, to get resources, and more important, to really lead projects to advance health equity in the regions. That before that, it was just us advising and trying to get some ideas, but now we are leading projects, so it's great for us. So give you a report about what.
I'm sorry to interrupt. Can you, we have some new folks that are unfamiliar with the term. Can you just do a quick share what a health equity plan is, what it seeks to do, what health equity is even?
Yes. So yes, thank you. And I will try to pass fast because I want to give you the time to interact with us about one aspect at the very end. But yes, you interrupt me anytime, please, and I will clarify whatever it's needed. So the usually health equity is the opportunity that we all have to uplift or diminish the preventable permissive effects of systemic inequities in the system that could be caused because of race, because of heritage, because of income, because of gender or identity. There are many reasons why, or language, access language is a very clear example. There are many reasons why the system lets out some people that can have better services. And for these reasons, they are not having the same level of access or quality of services. So the idea around the health equity plan is to identify those opportunities of improvement, to give everybody the same opportunities to have the medical services they need and deserve. And it's important, the health equity plan, because in the past we didn't have health equity was always there, but it was not in the contract with specific projects to advance these innovative and at the same time so logical ideas to have the same level of services for everybody. I hope it was some clarification. So, so I will share with you what happened with our submission to OHA, and then also share with you what happened when we try to assess the quality of our culturally and linguistically appropriate services inside Pacific Source, because we are trying to begin to elevate the capacity of Pacific Source to do the work. And so the first gesture was to know where we are and what needs to be improved. And we want to share that with you. Next slide, please. So the Oregon Health Authority review and approve our plan. We have a fantastic score, maybe one of, if not the highest, one of the highest, with 59 point of 62. The plan itself, it yes, thank you. It has 52 goals or projects across 8 different areas. And we have the suggestion of OHA to create next year a more a plan that has more regional approaches. That is very difficult at the moment, and we will keep that in mind. But it's difficult because at the moment, what we are focusing on, this is a 5-year plan, is to create the capacity to advance the work. So it's difficult for us to identify regional specific projects. We have four regions in the state, but we are trying to get there. And the CAC is so important in that regard because you are the ones who can give us feedback about what is specific to the region, and we hope we will collect that information and answer to that need. We just turned our health equity plan progress in August 10th, and we hope it's going to be okay as always. Next slide, please. So that was about the health equity plan and remission to Oregon health authorities. Let me now pass to this idea of assessing the class standards. What do we need and what we're doing about that, and why it's so important, the culturally and linguistically appropriate services for us. The entire health equity plan is based on the class standards. And that is why it's so important for us to continue to advance, get more clarity about what we are doing and how can we improve our services. Class standards is basically a tool for that. And even if in the name it says cultural and linguistically appropriate services, so it's more than just about language. much more. It's not only about language, it's about also the way that the organization behaves and thinks, the values, the accountability, the way that connects with communities. So can you give me the next slide? I think, yes. So the class standards at large have 3 main sectors. There are 15 class standards, and these standards are national. It's a national tool, and that has a big advantage because being national, there is many people feeding these tools with new research, with surveys. So in any aspect you want to advance your project or you have some interest, you can make sure that clicking on the link that we provide, you will find a tool that is close to your needs or some research that is happening sometime in the country to advance health equity. So there are 3 main levels of the standards. The first 3, it's about governance, leadership, and workforce. And we know how important and how crucial is this to improve the quality from an equity point of view. The next ones is basically around communications and language assistance. But the last ones are super important because it's about engagement, continuous improvement, and accountability. And you will see in the near future how there is more and more this need to include more the communities and to have more representation and to share, to find better ways to share the power on decision with the communities and community partners. So next slide, please. So we conduct an assessment, an internal assessment. So to clarify, this is just internal, so Pacific Source only. We didn't touch providers or community partners, but we wanted to know what we need to do to get better. And we have an assessment that includes 78 questions, and we found that we have 13 areas where we happy what we are doing, but 16 areas where we have some areas of opportunity. And we create a collective inside Pacific Source to try to, now that we identify those 16 areas where we have opportunities in all the 3 sectors I give you, so workforce, leadership, language access, and accountability. So now we need to work to advance those. Next slide, please. So yeah, next slide. So the entire health equity plan has 8 focus areas, beginning with complaints and appeals. We have several projects there leading to how to make this process, such a complex process, easier for the members. We have also an aspect about demographic, how to better collect and use demographic data to target health inequities. Obviously, a big chunk of our work is around culturally and linguistically appropriate services, that it's so crucial for us. So either in educating ourselves about what health equity is, and so many topics that we need to advance fast. Workforce and workforce diversity is another project. Organizational training and education around diversity, equity, and inclusion. And the ones that I want to share with you is about language access and member education and accessibility. Next slide, please. So language access. This is crucial for us because we know that so the access to interpretations, for instance, is so difficult. Sometimes because we don't have the resources to do that, but also because the process becomes difficult. So we're trying to find the ways to deliver the services or to provide the ability for members to have this when they need it to improve our quality. Next slide. So what we have been doing, we complete the review in our provider manual. we review all the manual to see where in the new contracts we can include key policies that will help us to enforce and advance that every provider offers these services. We know that sometimes it's difficult due to the size and of the provider offices. Some offices are very advanced on that. They even have, like Mosaic Medical, they even have an ongoing training to produce their own interpreters, but not everybody can do that. And even in some cases, not everybody wants to do that because they don't understand what is important. So we put in our policies, in our new contracts, this, we try to create the spaces where we can enforce in the future a better way to do this. What we have in process is a data tool to track the quality of the interpretations that the members are receiving, and also creating some surveys to see where are the needs about languages, what kind of languages we need to invest more. You know that medical interpreters is not an easy task. It's not just enough to speak to languages. You also need to understand the medical terminology and have a training about the how to provide a quality service. It's burdensome for the providers, for the member, for everybody. So we need highly specialized people, and that takes time to create that. So we need to identify where the opportunities are. For example, next slide. This is on language access. And what about member education and accessibility? Well, for us, it's super important that even when we provide the right information, this information many times is difficult to understand. And not just for people that has English as their second language, for everybody. So we want to make an effort to make this information more accessible to everyone. Next slide, please. What we have been able to do? Well, we create our first plain language reference for our team. So we create a guide to how to write, how to think in plain language to produce better, more clear, more simple to read texts. What we have in process is that we hope that we will have a member handbook that will be written, or at least have a clarification in plain language that will be accessible. Our normal handbook could be difficult to read for everybody, so we are making efforts into that. And also identifying key member materials that we can produce in plain language. This is what we are doing right now. And the last slide, I think is the last one, is when we want to, next slide, please. Yes. So what we want to share with you and listen what you have to say about this is that we hope to contract in the region, at least with the Latins, with the Latino service community partners, to do a cultural review of our Spanish member handbook. So sometimes the translations are fantastic, but they are not culturally appropriate. So the things that they are said is not in the way that the culture in this particular region will listen better. So we know that translators cannot do that work. So we want to rely on local organizations to help us to find a way that the entire message of at least the handbook is made in a way that is appropriate, culturally appropriate for the region. And we want to do that with the member handbook in the next year. So I stop there. I think that's the end of my presentation, and I open for questions and advice about how to do this with the support of community partners.
Gracias, Miguel. Thank you. Are you looking for advice on that last slide? The handbook and
yes.
Okay. Anybody have any ideas, thoughts, questions, advice? Yes, Stacy has your hand up.
Have you reached out to the community colleges with that question about reaching? So like the community colleges have a lot of different language programs and clubs, and that would possibly be something they're interested in working on because they also do a lot of community work as well.
Thank you, Stacy. That's a great idea. We work with community college in other projects, and but this is a good idea. There is at least a Latino club there, and that I can reach out. I will do that. Thank you.
Anybody else? Regina? Elaine?
I just
Go
want to
ahead.
say thank you. That is great work. And it's much needed around here, especially for the language and the population that we serve. You can put it in Spanish as many ways as you want, but are they going to listen? Are they going to know? No, probably not, because the culture part really is important.
Thank you, Regina. Thank you. Appreciate that feedback.
Elizabeth, Elaine, anything you'd like to add or ask or? No, okay. Anybody else? Any of our guests? Staff? Okay, Miguel, I had a question. Is it possible to add more? There's one thing about those handbooks is they're very text dense, and that's a turnoff to many people. So is there? Yeah, raise my hand too. Is it possible to add some, it doesn't have to be cartoon, but I'm just thinking like, cartoon imagery or even just flow charts. I don't know, just things that are image based versus text based.
Kind of like your guys' roadmaps that you guys had created at one point. I think those are eye-catching for some people, and it's also easy for us as community partners to actually, point out and show them, versus them trying to read all of that stuff that just rams together and goes in through one ear and out the other.
Yes. So Regina, Brad, thank you so much. It is so important that the visual language itself, it's so supportive of so many complex aspects, right? And yes, there are limitations because a lot of information that lives in the handbook has a legal content that we absolutely need to provide. But that doesn't impede us to look for aspects where we can clarify using a different language, which is the visual language. So in the past, a few years ago, I was able to push a handbook that never got alive. But now, with the training we are having internally about equity, diversity, and inclusion, our company is seeing that in a different way. And I think we will be able to include something like this in the future. People is more receptive to this idea of using diverse supports or complementary language, like the image in this case, and that's very powerful and helps to clarify, circulate, navigate easier the text. Thank you for the feedback.
Looks like Stacy's asking in the chat, will this handbook be formatted for cell phone viewing?
Yeah, the handbook itself, it's a booklet. It's a heavy booklet, but we are always trying. So I see difficulties to we haven't think about that. I would put that on the table because maybe it's a good option, right? So thank you.
I know just from being in the community, especially in a community college where I'm, a lot of people are needing certain services, that everybody, or at least that I've seen, as soon as you ask them a question they don't know, first thing they pull out is their cell phone. Yeah. I would also say, just from a personal cell phone user, if I see something that is overwhelming, I just close it.
Yes.
So I love personally seeing something that is formatted for my cell phone, smaller, shorter bullet notes, something easy to see, and links, being able to click on something and bring me to where I need to go and not have to. It was something we also studied in a technical writing class, is cell phone use being the new, norm for us.
Yeah, and we are trying to be open and at the same time, not just focusing on the new technologies, because we know that not all the people have the same access or have the same way to access information. But I think we have a lot to learn about that, how to use better the information, the new technologies. We are behind, but we are, making notes. Thank you for the advice.
Or just having a quick guide. I mean, I get that the handbook has to be detailed and to the point, just to save whatever, policy or whatever it may be, but having a quick guide to format that into a smaller portion size, pictures, things like that, and they can pick and choose which one they want to read through, and knowing that the hefty one is still available online or with you guys. I think that would be a good
Thank you, Regina.
tool. Yeah.
Great. Wow, great advices. Thank you. That was a good day.
Gracias, Miguel. Thank you very much.
Thank you.
We're gonna move on. We're about out of time, so thank you very much.
Thank you for having us.
And to everybody for your thoughts and ideas and participating. The last little piece here, I'm gonna have to ask Michaela and others. Is this, what are we wanting to get out of this last section here? The DEI, I'm not really sure.
For quick announcements.
Just that it's being worked on. There's a diversity, equity, inclusion, and justice statement that I believe the staff is taking a first stab on, and then you're gonna ask for input on that, or what's the process?
Oh, yes. If Michaela, could you go to the next one and come back to me and I will share that?
And that's a statement. Is that a statement for the CAC or for the Health Council more broadly?
Much more broadly, it's for the Health Council.
Okay.
Okay. Next announcement is the 2021 Community Health Projects applications. We'll be sending those out on Friday and Monday for all the CAC members to review. There's 10 of them. And then we're gonna have you rank 9 of them. So that information, directions on how to do that will be sent to you Friday and or Monday, depending on whether or not you want to do it electronically or have a hard copy and submit your rankings, in paper. So we'll just keep an eye out for that for tomorrow or Monday.
And how many applications are we all reviewing all the applications at this stage?
Yep, you'll be able to see all 10 of them, the full applications. And then we'll make decisions at your November CAC meeting.
Okay. And for those of you who don't know, we received how many? 30-ish applications, maybe more.
I want to say in the 20s.
Okay, maybe close, high 20s. Applications for funding. The Community Advisory Council has a pot of money that we are charged with distributing to community organizations, and then we've got a whole kind of criteria around kind of a weighted importance of what's important to Community Advisory Committee in terms of what those projects are going to accomplish. And the CAC members divided into 2 groups, reviewed half of those applications in each group. Each group reviewed half the applications, and we came together, chose 9. No, we chose more than 9. We choose more than 9?
Well, we chose 9. There's one from the Confederation.
Okay. And those were actually letters of interest, and then they were invited, the 9 were invited to come back and submit full applications, and that's what we're going to be reviewing very soon. The last bullet point there is Cover All People. Cover All People is a piece of legislation that was passed in, I believe, this past June or July. And that is, there's been a segment of our community, essentially undocumented individuals, immigrants, have been excluded from receiving Medicaid benefits or Oregon Health Plan benefits. And Cover All People will include them in receiving Oregon Health Plan benefits. And I have asked Oregon Health Authority folks, what is the actual rollout on this? When will people be able to apply for that benefit? And there still is not the last I heard, there's no actual date yet. But my understanding is it will likely be in June or July of 2022, but nobody's able to answer that question yet. They're kind of
So
working.
Brad, the cover all people will be part of the waiver. And so the waiver will be submitted to the federal government in, I think, the end of December or beginning of January. So end of 2021 or beginning of 2022. And then there's a period of time where the federal government looks at all of the requests that are part of the waiver, and Cover All People is part of that. So it's an expansion of Cover All Kids to Cover All People. So it'll be part of that. And then if it gets approved, I think the state will be notified in the spring, and then it'll go into effect probably June or July.
Okay. Thank you.
So that's sort of the process that's moving it forward.
Thank you, Rebecca.
Yeah.
Appreciate that.
Well, I thought I had got an email on a conference tomorrow on Cover All People, but maybe I didn't. I'm just trying to find it now. Does anyone know about that?
I'm sure that's possible, that there's probably community discussions giving input to the process. So that's entirely possible.
Okay.
We'd love to know about that. Yeah, I haven't seen that, Elizabeth. So thank you for bringing it up. If that is happening, would somebody please get that to the CAC members?
Okay. If it is, it's tomorrow. I just can't find it. I'm looking on my tablet. So if I find it, I'll give you a call.
Okay. Or send it to Michaela or Kelly.
Okay.
Yeah.
Okay. All
Thank
right.
you.
Thank you.
All right, everybody. Thank you very much.
Brad,
Yeah.
hold on. I want to speak really quick to the diversity, equity, inclusion, and justice statement, because there's a number of folks on CAC that aren't in work groups, so they wouldn't have heard this. So the Health Council's vision is to build an equitable and integrated health ecosystem that improves the health of all Central Oregonians. You all are CAC members and our partners throughout our region and various communities have asked the Health Council to elevate the role of diversity, equity, inclusion, and justice in achieving health equity. And the Board of Directors has prioritized this in their strategic plan. So our DEI, or Diversity, Equity, Inclusion Committee, has created a statement of organizational commitment to diversity, equity, inclusion, and justice. This statement has taken over a year to create, and it really marks just the next chapter of the Health Council's work on diversity, equity, inclusion, and justice. The language we know holds the statement we know holds some strong language. And so we really want to support you in your own journey with these concepts and this understanding. And we ask you to take from the statement what you can to learn and grow. So we make this public statement because it demonstrates the Health Council's commitment to building an inclusive organization, welcoming to people of all backgrounds. It serves as a signal for what an organization stands for and how it intends to serve all of your communities. It's much like a vision and mission statement. It guides culture, thinking, and practices. This statement, along with some supporting information that talks about some of the words used, the history of the Health Council working with diversity, equity, inclusion, and justice, is included in your packet. And it will live on the website. We're also looking at sharing some of the action plans that our DEI committee, as well as our board, have been working on. So please take a look at this in your meeting packet. In the next week, you'll receive an email with a survey link to provide your feedback, your support, and concerns about such a statement. Then we are gonna be providing this information to the board of directors in November, and they are going to take those considerations and make a final decision about formalizing this statement as part of the health council structure. So if you have any questions, we're happy to hang on or answer emails or phone calls around this as well. Thanks, Brad.
Thanks, Gwen. Fantastic. It's good news, good progress. So yeah, please do look at it in the packet. I'll admit I've been busted, didn't review the whole packet. I will now though. So please review the packet. If you are a CAC member, you receive the packet, the meeting packet, and reach out to staff and or respond to the survey when you get that in your email. And please do. And we'll see where it goes. Well, thank you, everybody. I want to honor your time. Appreciate your participation and have a fantastic day.